my disease. All right, so what is Streptococcus pneumonia? It's an extracellular opportunistic pathogen that colonizes the upper respiratory tract at the mucosal surface. It spreads by close contact to the host and is frequently transmitted during drier, cooler months, when airway secretions are more prevalent and more likely to occur along with other respiratory tracts, for example, influenza, or also known as the flu. It's most commonly seen in children, but it can also be contracted by adults as well. So, how does this disease work? Community acquired pneumonia, also called CAP, it's caused by mechanisms of influenza virus, which predisposes people to Streptococcus pneumonia. So, the co-infection of influenza and Streptococcus pneumonia results in an increased chance of adherence mediated by neurometastatic activity. Influenza helps remove celiac acid from the mucosa and exposes bacteria receptors. This action allows for Streptococcus pneumonia to adhere more efficiently to the tissue of the lungs. So, like I said before, restated influenza and Streptococcus. In order for Streptococcus pneumonia to take effect, something like an influenza has to be there to remove that celiac acid. That way, it can allow it to attach to the tissue of the lungs. And so, as this attachment spreads to the bronchioles and bronchioles and alveoli, causes inflammation, and as this gets stronger, it leads to congestion and red hepatization, leading to further inflammation, fluid, and accumulation of erythrocytes in the fibrin mesh. And so here's a diagram. Like I said, Streptococcus pneumonia. Here it's adhering to the mucus and transmitted by airborne and invades here the lungs. It could also Streptococcus pneumonia can affect the brain and also the ear. So common diagnostic procedures. So CAP caused by Streptococcus pneumonia. It can be diagnosed in many different ways. One way, which is here presented on this picture right here, is a urinary antigen testing, uh, which helps detect Streptococcus pneumonia within 15 minutes, as well as chest radiograph, a swelling test, blood testing, and examination of secretions that comes from the lungs. And some symptoms that patients with Streptococcus pneumonia can have, or CAP caused by Streptococcus pneumonia can have, include productive cough, fever, pleuritic chest pain, and infection of upper respiratory tract. So some common medical treatments and prognosis. The prognosis for Streptococcus pneumonia can be extremely fatal if the patient does not take advantage of extremely effective treatments and vaccinations, including pneumococcal conjugation vaccines. There's three types: PCV 13, 15, or 20, and pneumococcal polysaccharide vaccine PPSV 23. So, despite the various treatments available to prevent Streptococcus pneumonia, it's the eighth leading cause of death, claiming 51,000 Americans in the United States, and every year 500,000 children die under the age of 5 years. So like I said, this is disease prevalent in both adults and but mostly children, which affects them the most, since they're most vulnerable to early on in their life for diseases. It is important to note that the vaccinations that protect most pneumococcal bacteria do not provide 100% protection, and so this can cause reinfection after receiving this vaccination. It's also a good idea to receive the flu virus since CAP has a strong relationship with influenza and Streptococcus pneumonia. So, influenza vaccine coupled with these vaccines previously stated above can increase the chances of not getting a reinfection. So, some physical impairment and functional limitations about this disability. So, some physical impairments include tachypnea because of the lack of adequate gas exchange in the alveoli, which then causes patients to compensate by breathing faster. And this could lead to heart failure, which is not good since you're not getting enough oxygen, so the blood has to pump more blood into the lungs. That way, it can get oxygen to the deoxygenated red blood cells. And so, other physical impairments include impaired airway clearance, impaired cough, and dyspnea at rest or with exertion. So, functional limitations include decreased bed mobility, decreased gait, and increased dependency, which also contributes to disabilities like not being able to perform any activities because of lack of gas exchange occurring in the lungs, and also leaving patients bedridden, which is not good for patients. So, as previously stated, these are disabilities, function limitations, impairments. So, how can physical therapy help? Some of interventions that can help patients return to homeostasis, which is basically those internal levels being at the normal, include airway oscillation devices, high frequency chest compression devices, postural drainage, to help maximize, and all these things help maximize the matching ventilation perfusion ratio by removing secretions and improving the gas exchange in the lungs. And that helps us to breathe better, allows us to give more endurance and stuff like that. So for postural drainage in the lower segment lobes can be beneficial for patients since the mucus builds up. Mucus buildup starts in the lower lobes. Therapeutic exercise can also help improve the ventilation perfusion ratio, like working on accessory muscles that help with inhalation and exhalation to improve the overall gas exchange that patients need and it's necessary so they can be able to return to activities of daily living without that lack of breathing or dyspnea. And here's some postural drainage. This is the high compression. It's used for breathing and as well as drainage. Here's some pictures of different positions. You would use the last segment down here for the lower lobe since the mucus, those secretions drain down to the bottom, those lower lobes. So those right here would be a lot more beneficial when treating a patient. So some precautions and contraindications that are important for us to have in mind. It's important that the therapist wears personal protective equipment, PPE, like gloves and hazmat suits to prevent any contaminations and Streptococcus pneumonias and airborne infection. It is also important to clean and avoid any contact with objects or secretions that have been in contact with the patient. Precautions may include not performing any activity that this patient is or out of their limit of breathing capabilities because the airway secretion dysfunction that they have would cause patients to pass out since they're not able to breathe well, they're not able to get that good gas exchange. Pushing them too hard will have them pass out. So in conclusion, Streptococcus pneumonia is an extracellular opportunistic pathogen that colonizes the upper respiratory tract of the mucosal surface, and this most commonly causes community-acquired pneumonia, or CAP, which leads to congestion, red hepatization in the bronchioles and alveoli. Vaccinations for Streptococcus pneumonia, as well as the influenza shot, are available for preventions to reduce the chances of the effects of reinfection or infection. Physical therapy can also help alleviate and help education of patients with Streptococcus pneumonia to relieve secretions with interventions and therapeutic activities. Thank you and have a good day.